Next I'm going to have you lay down on the couch. Make sure you lay far enough. Okay, we're going to check your jugular venous pulsation. Nope, you're going to lay flat. You're going to check your jugular venous pressure, or pulsation rather. I want you to turn your head to the left. Okay, so it's a little different than the carotid artery. Carotid artery is just located just within the sternocleidomastoid muscle, and the jugular venous pulsation, usually you can see when you're lying flat, which I'll shine my light on, and I can see it just outside of the sternocleidomastoid muscle. And then as I raise the head of the bed, and okay, that pulsation will disappear as your blood pressure drops. Next, we're going to inspect the precordial area of the body, and I'm going to palpate right at the apex of the heart. No abnormal thrill noted. Good. I'm going to auscultate for 15 seconds your apical pulse with the bell of my stethoscope. Okay, good. And next I'm going to auscultate the 4 different heart sounds with the diaphragm of my stethoscope. Good. So basically, I listen to, you go down to the second intercostal space, to the aortic valve closing, and then you go straight across to the pulmonary valve, which is also the second intercostal space on the left-hand side of the body. You step down to the fourth intercostal space, to the cryocuspid valve, and then you go down to the fifth intercostal space for the mitral valve. Now the mitral valve is the apex of the heart where you can hear S1, which I heard it perfectly, and then the aortic valve up here on the right-hand side of the second intercostal space is the base of the heart, and that's where I heard S2. So I'm going to turn my diaphragm over to the bell, and I'm going to repeat this steps and to make sure that I do not hear any murmurs, S3 or S4 heart sounds. And there are no extra beats or heart sounds noted, no murmurs on that examination. Next, I'm going to move down to auscultation of the abdomen. First, I just inspect the area, and now I'll auscultate in all 4 quadrants, starting at the right lower quadrant. Okay, good. Positive bowel sounds times all 4 quadrants. Next, I'm going to move into listening to the vascular sounds of the aorta. Good. Next, I'm going to percuss the abdomen, starting at the right lower quadrant, and I'm going to percuss in a zigzag pattern. And next, I'm going to do some light palpation in a circular motion with my fingertips. Does that hurt at all?
No.
Good, okay, this completes this part of the exam. I'm gonna move on to your hips. I'm gonna have you just, bend your right knee up. Good, extend it out towards me, extend it in towards you. Good, lower your leg down. I'm gonna have you do the same with your left leg. I know it's hard with the couch. Good, extend out, internally rotate in. Good, okay. I want you to, I'm gonna hold this leg down, try to push against my resistance. Push up, good. Again with this one, good. Okay, I want you to try to touch your right heel to your right shin, or left shin, and go down to your feet. Good. And now do the same with the other leg. Very good. As I'm doing this assessment, I'm still looking at his hair distribution, which is evenly distributed throughout his legs. I'm feeling the bottom of his feet with the dorsal part of my hands. His skin is clean, warm, dry, and intact. I'm going to test his capillary refill response by pressing on the nail beds of his toes. And he's got good capillary refill response, less than 3 seconds on both toes bilaterally. Next, I'm going to have him, I want you to press on the gas pedal, okay, of my hands. Press, 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 okay, pull up. Good job. Okay, good equal strengths bilaterally. I want you to invert your feet inward and externally rotate them out. Good. Okay, I want you to just sit at the edge of this bed. I'm going to use my stethoscope, and we're going to check your patella reflex. Right. So I'm just going to use the bottom of the stethoscope, and I'm going to hit right below your patella, which is your kneecap. Good. Maybe have your feet just dangle a little bit if you can. Good. 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 While you're here, I will, you know what, actually, lay back down real quick for me.
Which way?
Flat.
On my stomach?
No, not yet. Down on your back. Go down on your back. Okay, I'm going to feel your popliteal pulse. Bend your knee up a little. Good. And then I'm going to move down to your dorsal tibia pulse. Good. And then I'm going to feel your right-sided, the pedal pulse. Good. And I'm going to do the same with your left leg, your popliteal pulse. Down to the tibia. Very good. And then relax your foot down, and then your pedal pulse. Okay, rotate back on your stomach for me. And what I want you to do is to bend your leg up. Okay, and I'm going to pull, and you're going to pull towards your bum. Good, good resistance. Next with this leg. Very good. Okay, flip back on your back. We're almost done. Okay, we're making good time. So I'm going to do the Babinski reflex. Good. Good. And before we continue with the exam, I do want you to lay a little bit on your left-hand side. I'm going to use the bell of my stethoscope and listen to your, put your arm by your side, to your apical pulse. Or the apex of your heart, rather. And your apical pulse. Thank you. Okay, and now you can sit on the edge of the bed for me. Okay. Close your eyes, and I want you to tell me when you feel something touching you, and what does it feel like, okay?
Yep. Soft. 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 Soft.
Good. I also examined this patient with dull and sharp technique as well, and he passed. was within normal limits. Next, I want you to close your eyes and I want you to hold out your hands. I'm going to place something in your hand. You got to tell me what I'm placing in your hand.
A key.
Good job. Now I'm going to place something right in your left hand. Keep those eyes closed. Tell me what you feel.
A nail.
Good. Next, I want you to, I'm going to have you face the camera a little bit. I want you to touch your fingers, each finger with your thumb at a pretty rapid pace. Good. I want you to shake your hands like water. Great. Now I want you to just stand up for me and go back there a little bit so that the camera can see you. Stand right about there. Good. Now feet together and close your eyes for 20 seconds. Good job. Good balance. Next, I want you to walk on your heels across the room. Good. Now just walk heel toe, and turn around. Good, and come back on your tippy toes. Heel toe. Heel toe, tippy toes, heel. And then, I think that's it. So I'm going to take a seat. And then I just want you to flex your legs outward and bend your knees in. Bend up, as much as you can. Okay, that completes this examination. Thank you very much for your help. Okay.
Thank you.
Thank you.